Before starting any weight loss program, it's essential to discuss your plans with your healthcare provider. They can help you evaluate the safety and effectiveness of different options based on your individual health conditions and goals. There is no single best weight loss program that works for everyone. And so it is something that is very individualized. Effective programs are tailored to individual needs, preferences, and lifestyles. What works for one person may not work for another. You want to evaluate past experiences. So reflect and consider what weight loss strategies or programs have been successful or unsuccessful for you in the past, and reflect on those experiences can help you choose a program that aligns with your personal preferences and goals. And different programs offer varying types of support. So deciding whether you prefer online resources, in-person meetings, individual counseling, or group settings, your preference for support and accountability will impact your adherence to the program. So look for programs that offer features and strategies that resonate with you, such as meal plans, exercise routines, behavioral coaching, or lifestyle adjustments. Some additional considerations are sustainability. You want to choose a program that promotes long-term lifestyle changes rather than quick fixes. Sustainable habits are key to maintaining weight loss over time. When selecting a weight loss program, it's important to choose one that is both safe and effective. Here are some key characteristics to look for in a weight loss program. Behavioral and lifestyle guidance. So a good program should include guidance on developing and maintaining healthy habits that support weight loss, such as dietary changes and physical activity. Look for programs that offer practical strategies for integrating these habits into your daily life. The program should emphasize the role of quality sleep and stress management in overall health and weight loss. Both are crucial for maintaining healthy weight. And the program should provide information about the benefits and drawbacks of weight loss medications if applicable. This helps you make informed decisions about whether medication is right for you. Choose a program that offers continuous feedback and support, whether in person, by phone, online, or through a combination of methods. This ongoing support can help you stay on track with your goals. A safe program should recommend gradual weight loss, typically 1 to 2 pounds per week. Initial faster weight loss can occur, but the focus should be on sustainable long-term results. Programs should include strategies for maintaining weight loss, such as goal setting, self-checks, keeping a food journal, and access to counseling support. You want to use caution when programs make certain promises. So be wary of programs that promise no diet or exercise, losing weight without changing your diet or increasing your activity level, or unlimited eating, losing weight while eating unlimited amounts of your favorite foods, or targeted weight loss, losing weight specifically from problem areas of your body. Weight loss programs come in various formats, each offering unique approaches and benefits. Here's a breakdown of the main types of weight loss programs. So in-person weight loss programs. These programs typically involve face-to-face interactions with health professionals or weight loss counselors. One effective technique used in these settings is motivational interviewing. This method helps individuals explore and resolve their ambivalence about changing behaviors, which can enhance motivation and commitment to weight loss goals. Online or app-based programs are accessed through the internet or mobile applications, providing flexibility and convenience. According to a review by Wright and others, e-health platforms are a suitable option for individuals with obesity, especially those with limited or no access to traditional healthcare teams. They offer resources, tracking tools, and virtual support that can be highly effective in managing weight. Behavioral group therapy. Group therapy sessions involve meeting with a group of individuals with similar weight loss goals. This format can be a cost-effective option and provides valuable support. Group settings foster accountability and shared experiences, which can enhance motivation and adherence to weight loss plans. When it comes to supporting healthy body weight in children and adolescents, specific evidence-based interventions are tailored to different age groups. So for those who are ages 2 to 5 years of age, they typically interventions in the home and the family. You want to focus on engaging family members to create a supportive environment for healthy eating and physical activity. In healthcare settings, there are regular checkups and guidance from healthcare providers on maintaining healthy weight. And then community settings, programs that involve community resources to support healthy behaviors in young children. For ages 6 to 12, interventions in schools, so school-based programs that include education on nutrition and physical activity and promotion of healthy school environments. And regulated screen time, implementing guidelines to limit screen time to encourage more physical activity and reduce sedentary behavior. For children and teens, nutrition with physical activity, so emphasizing the importance of a balanced diet combined with regular physical activity. And multi-component, multi-level, or multi-setting interventions. These are programs that integrate multiple strategies across different settings, home, school, community to support overall healthy behaviors. Policies to improve access to healthy foods, advocating for policies that make nutritious foods more accessible and affordable. Intermittent fasting has gained popularity as a dietary approach that involves cycling between periods of eating and fasting. Let's delve into the three main types of intermittent fasting and their characteristics. There's alternate day fasting. This method involves alternating between days of regular eating and days of fasting. On fasting days, no caloric foods or beverages are consumed through non-caloric options like black coffee, tea, and water are allowed. On feeding days or non-fasting days, you can eat normally, but it is recommended to focus on a nutrient-dense diet to maximize health benefits. Modified fasting, so rather than completely abstaining from calories on fasting days, a modified fasting restricts caloric intake to 20 to 25% of daily needs, or typically around 500 calories per day. There's also a 5 to 2 fast. It's a common variant approach where you eat normally for 5 days of the week and you fast for 2 non-consecutive days. And then time-restricted fasting. This type limits caloric intake for specific hours of the day. For instance, you might eat during an 8-hour window and fast for the remaining 16 hours of the day. Some protocols extend the fasting period, with individuals fasting for 16 hours or more each day. These fasting period includes the sleep hours. So some key points to consider. Research shows that intermittent fasting can aid in weight loss and improve metabolic health, though individual results can vary. And sustainability. So choosing a fasting method that aligns with your lifestyle and preferences to enhance adherence and effectiveness. So now we'll talk about high protein diets. And really, there's no universal standard for protein intake. Recommendations can vary based on individual needs and health conditions with this diet. High protein diets have shown notable weight loss effects, especially in individuals with obesity, prediabetes, and specific genetic risk factors. However, these effects are often more pronounced in the short term. Long-term trials on high protein diets are inconclusive, and more research is needed to fully understand their benefits and risks over extended periods of time. For the high fat or keto diets, the diet composition, a classic ketogenic diet is highly restrictive, providing approximately 90% of calories from fat, with 6 to 8% from protein and 2 to 4% from carbohydrates. This significant reduction in carbohydrate intake shifts the body into a state of ketosis where fat is used as the primary energy source. The long-term safety of the ketogenic diet remains under investigation. While it may lead to weight loss, the potential for adverse effects needs further exploration. Individuals may experience side effects such as fatigue, headaches, nausea, low blood glucose levels, and constipation. the key takeaways are dietary approaches should be tailored to individual health conditions and goals. And both high protein and high fat diets require ongoing research to better understand their long-term impacts on health. Bariatric surgery can lead to substantial reductions in body weight and body fat, and often results in improved body composition and a decreased risk of chronic diseases such as type 2 diabetes, hypertension, and cardiovascular issues. There are some enhanced health outcomes. By addressing obesity, bariatric surgery can also contribute to better overall health and quality of life. But there are also potential side effects. There's a reduction in cardiorespiratory fitness. So after surgery, some individuals may experience a decrease in cardiorespiratory fitness. That reduction can occur due to decreased physical activity levels or changes in body composition, which may affect overall endurance and aerobic capacity. There's also a sarcopenic obesity that is a concern where individuals lose muscle mass while retaining or even gaining fat mass. This condition can complicate weight management and impact athletic performance negatively. Some key considerations are engaging in a structured rehabilitation program that includes strength training and aerobic exercise that help mitigate some of the negative effects on fitness and muscle mass. And regular follow-ups with healthcare providers are crucial for monitoring body composition and adjusting physical activity plans as needed to maintain optimal health and performance. The recommendations for exercise before and after bariatric exercise are as outlined by the American Society for Metabolic and Bariatric Surgery. Pre-surgery exercise recommendations are for mild exercise. It's advised to engage in mild exercise such as aerobic conditioning and light resistance training. Aim for 20 minutes of exercise per day, about 3 to 4 days per week. This routine helps prepare the body for the demands of surgery and contribute to a smoother recovery. Post-surgery exercise recommendations should align with general adult health recommendations. This includes integrating physical activity into daily routines and achieving at least 150 minutes of moderate intensity physical activity each week. Incorporate muscle strengthening exercises that target major muscle groups at least twice a week. This helps in maintaining muscle mass and supporting metabolic health. Regular exercise before surgery can help improve overall fitness and potentially reduce surgical risks. After surgery, consistent exercise supports a healthy lifestyle and aids in effective recovery. And maintaining an active lifestyle in the healing process and in achieving and sustaining weight loss goals. It also enhances physical and mental well-being, contributing to better long-term outcomes. Weight loss, whether intentional or unintentional, can sometimes negatively impact both health and sport-specific performance in athletes. It's important to understand the factors at play. Energy availability is a key concept that measures the balance between the calories consumed and the calories expended through exercise. When an athlete's food energy intake is less than their exercise energy expenditure, they experience a low energy availability situation. This can lead to weight loss and severe adverse effects, including decreased performance. So low EA can result in diminished physical performance due to insufficient energy to fuel high intensity and prolonged exercise. Prolonged periods of low EA can lead to issues such as decreased bone density, impaired immune function, and hormonal imbalances. Reduced energy availability can increase the risk of injuries and impair the body's ability to recover effectively from training. To maintain optimal performance, athletes need to carefully manage their energy intake and expenditure, ensuring adequate EA for sustaining training, intensity recovery, and overall health. Each athlete's energy requirements will vary based on their sport, training load, and individual metabolism. Personalized nutrition and training plans are essential for managing weight loss without compromising performance. Weight cycling refers to the repeated loss and regaining of body weight. This often occurs when individuals engage in extreme measures for rapid weight loss, followed by periods of weight regain. Common scenarios: weight cycling is particularly prevalent among athletes in sports that emphasize weight categories, such as boxers, mixed martial arts fighters, weightlifters, jockeys, dancers, gymnasts. Studies suggest that repeated cycles of weight loss and regain may increase the risk of developing obesity later in life. This risk is attributed to several factors. The metabolic changes, so the frequent fluctuations in body weight, can alter metabolic processes, potentially leading to increased fat accumulation over time. Weight cycling may disrupt the body's natural appetite regulation mechanisms, making it harder to maintain a stable weight. And weight cycling can also contribute to the development of cardiometabolic conditions, including type 2 diabetes. It may impair the repeated weight fluctuations, may impair insulin sensitivity, and hypertension. So fluctuating weight can increase the risk of high blood pressure. And weight cycling may affect lipid profiles, increasing the risk of cardiovascular diseases. So to manage weight cycling for long-term health, it's crucial to focus on sustainable weight management practices rather than extreme short-term measures. Athletes and individuals should aim for gradual, steady weight loss and avoid rapid fluctuations to minimize potential health risks. And key concepts for Chapter 11 are mindful eating practices, such as eating slowly, savoring our food, and being aware of hunger and satiety cues. It may be beneficial in the management of overweight and obesity. Mindful eating has been associated with positive changes in both mental and physical health. Food addiction can contribute to overconsumption of palatable foods, likely leading to unhealthy weight gain. There are complex biological mechanisms at play with regard to overeating. A complex relationship exists between obesity and mental health. A person with obesity is more likely to experience anxiety, depression, and other mental health conditions. At the same time, anxiety, depression, and other mental health conditions can contribute to obesity. And individuals with obesity may concurrently have an eating disorder, most commonly binge eating disorder. For this reason, treatment plans for obesity should be developed with care and intention for the individual. And that is all that I have for you today. I'll be looking to talk to you again. We'll be going into Chapter 12. Here we go. Have a great day.